All right, good afternoon, everyone. I'm Allie Schulman, and I'm the Manager of Marketing and Communications here at the SFIA. As many of you know, the return to play amid the COVID-19 pandemic has been somewhat of a contentious topic, especially as we move into colder months and sports move indoors. In the sports industry, there has been much discussion about what a return to play should look like and what necessary precautions must be taken, but there is still ambiguity and uncertainty as the virus continues to spread. The CDC has publicly commented on the subject, and while we invited them to share their perspective, they were unable to join us today. Luckily, we have a representative group of leading experts in the youth sports and/or medical fields joining us today to share how they have been addressing COVID concerns over the last several months. Each of our speakers will share a 15-minute presentation. After all three presentations, we will open it up to questions from the audience. First, I would like to introduce Dr. Laura Defina, President and CEO of the Cooper Institute. Dr. Defina has devoted a majority of her career to ensure all children have access to quality physical education, as well as fitness assessment to ensure that they are gaining the health benefits of regular physical activity. The Cooper Institute has conducted thorough research on the impact of the pandemic on youth physical activity over the past several months and has addressed national priorities moving forward. We also have Dr. Bill Roberts, a professor, Director of the Sports Medicine Program at the University of Minnesota Medical School, Vice Chair of Faculty Affairs in the Department of Family Medicine and Community Health, and he is the past president of the American College of Sports Medicine, or ACSM. Dr. Roberts has spent his entire career in sports medicine and is an expert on communicable disease such as COVID-19 and how a too soon return to play could backfire. Lastly, Jason Clement, founder and CEO of one of the top sports facility companies in the country, Sports Facilities Companies. Jason Clement has led his facilities, which are massive indoor sports complexes located across the United States, to reopening and hosting games and tournaments amid the pandemic. With this comes great responsibility and thoughtfulness and care as to how to return safely for all players, officials, families, and fans. Jason will be discussing his best practices and what they've learned on the front lines of return to play, especially in indoor spaces. Please remember, we will be doing a live Q&A with Dr. Defina, Dr. Roberts, and Jason Clement following their presentations. So please submit questions using the question bar on your screen throughout the presentations, and we will address them once the presentations are complete. With that, I would like to turn it over to Dr. Laura Defina, President and CEO of the Cooper Institute.
Thank you, Allie.
Pull up the presentation.
Okay, thank you very much, and thank you all for being here today. The topic of youth physical activity, physical education, and health is so critical during the pandemic because we were already struggling with the obesity epidemic. Okay. The COVID-19, oh, I'm so sorry, the slides didn't catch the first time. There we go. The COVID-19 pandemic has led to extraordinary measures aimed at containing the virus, including social distancing, sheltering in place, school and business closures that led to remote and hybrid learning. Before COVID-19 ever came out, it was well known that school closures and remote learning environments could lead to a negative impact on youth health, both fitness and body mass index, which could have greater health implications, and a decline in academics. But never before have we really seen extended breaks as we have seen during these last 8 or 9 months. I'm sorry, the slides are going a little slower than I thought. Okay. So at the Cooper Institute, we have two school-based programs. One called the Healthy Zone School Program with the United Way of Metropolitan Dallas, where we provide resources and education for PE teachers to help make their schools a healthy zone, if you will, and give children every opportunity to grow up healthy. And then we have the NFL Play 60 Fitnessgram program, which similarly allows a multifaceted physical activity, nutrition, and wellness programming at the school level. One of the programs that we do have is Fitnessgram, which is a fitness assessment tool. And Fitnessgram is used throughout the 50 states. And one of the early questions we asked ourselves was, what is going to happen to PE and physical activity during the distance learning and the pandemic? And what are the challenges experienced by educators during this time? The educators we particularly focus on are physical education teachers, and in general, what physical education teacher thought they would be teaching online versus in person and directly with the kids. So ultimately, we did a survey that 2,440 respondents answered, and there were representation from all 50 states. Allie, the arrow, okay. The arrows are gone. I apologize to everyone who's there. Okay, perfect. Okay. So the first question we asked ourselves was, did PE or physical education get maintained at all during the early days of the pandemic? And the survey was done in the April-May time period. On the left, you see the schools that were closed during the pandemic, and on the right, you see the schools that were opened. And first of all, one nice thing from my perspective is that before the pandemic started, almost no schools had 0 hours of physical activity. And across the x-axis, you see increasing hours of physical activity up to greater than 4 hours. In the schools that closed, only about 20% had 0 hours of physical activity once the pandemic closed the schools. Now, the schools that opened, though, looked somewhat different. They had a slightly higher rate of no PE before the schools closed, but once the schools closed, the rate of no PE jumped to 60%. And in that group of students, the rationale was severalfold. First, they didn't have access to their gyms. Second, there was a fear of touching the same product, so a ball or a kettlebell. And so the kids really just were kept at social distancing and hence could not have physical activity. So it was certainly concerning that in both scenarios, the physical education piece did not get continued. Then we asked the teachers what they thought their kids were doing in terms of physical activity, particularly when we know that there's a physical inactivity problem in children today. And what we found using a Likert score was that 79% of the educators felt that their students were either significantly less or somewhat less physically active after the closure. For us, that really was enlightening, and it really pushed the point home that we needed to think about what can we do to help kids be more active so the obesity epidemic does not get worse. Now, in terms of what the challenges were, they were somewhat different for the closed schools than the open schools. The closed schools very much addressed the issue of access. Would the students have access to online learning? And I'm sure in many of your communities like ours, children were lost to technology, either because there wasn't Wi-Fi available in their community, and a lot of work was done on that just to get the kids back online. There was difficulty with the teacher-student communication, so even speaking to them, let alone educating them, was difficult. And then, as I said earlier, the remote work arrangement for PE teachers was just not part of what was considered normal. And there wasn't a lot of curricular material for PE teachers. For the open schools, though, the challenges were very much what we all struggle with: social distancing, access to their gymnasiums and equipment. And then in those surveys, we saw a lot more fear, concern for personal health and well-being, concern for the kids that they were educating. Now, we asked ourselves whether this was just a unique phenomena to both our schools and the United States. And actually, 2 studies were published from around the world. One in Verona, Italy, which was a longitudinal study. It was actually a weight loss study. And they found that during the pandemic, the kids spent 2.3 hours less time in sports, but 4.9 hours more in front of a screen. A questionnaire was done in Shanghai on 2,426 youth, and there they found a significant decrease in physical activity by 1/5, down to 105 minutes per week. So they're not getting anywhere near the 60 minutes per day. And then the prevalence of inactive youth increased threefold, from 21.3% to 65.6%. So again, this was not a phenomenon unique to the United States or to the schools that we were involved in. So what did we do? I mean, we looked at this as a tremendous issue, and our programs were all school-based. And there's great evidence, as I'm sure all of you know, that school-based programming that looks at physical activity, nutrition, and other aspects of healthy living has a lot of positive benefits: reduced obesity weight, improved mental health, improved brain health, improved cardiorespiratory fitness, improved academic achievement, decreased behavioral trouble, as well as increased attendance, which for many schools actually results in increased pay to the school. With COVID-19 adding additional stressors, it makes the school-based programming much more difficult to figure out how to manage. And what were the additional stressors? Well, food insecurity, self and family care insecurity, employment and housing insecurity, as I mentioned earlier, the technology, and then opportunities for exercise, particularly in the early days when there was so much fear of the unknown. For our programming, we were very fortunate to have funders who let us unrestrict our funding very early, and we expanded the scope from just addressing physical activity, nutrition, and lifestyle behaviors, but we addressed the basics of life: food insecurity, the essentials that kids would need, and very quickly worked with our partners to get online resources out there that teachers could use to help the children to be active despite whatever unique situation they were in from COVID. And the last point I want to make is that we've revisited some of our teachers this fall, and what we have found is the ones that have open schools are saying PE is a total different animal now. Previously, PE was a lot based on games and sports. Today, in order to maintain social distancing, what they are seeing and doing is more like physical fitness. They're doing 6 feet apart separated, push-ups, jumping jacks. And on the one hand, it's different socially, but on the other hand, we wonder if it might offer a road into teaching life-based physical activity behaviors. And at that, I am done. Thank you.
Thank you so much, Dr. Defina. All right. Next, we have Dr. Bill Roberts, former ACSM president and current professor and director of the sports medicine program at the University of Minnesota Medical School.
Well, thank you, Allie. Um, what I'm going to focus on this afternoon is how COVID is spread and what we can do to try to reduce that spread. So the, the title that I'm going to work off of is Sport and Indoor Facility Safety. So the first thing I want to talk about is how is coronavirus spread, and there are really several mechanisms. And the first one I'd like to consider is exposure time. And this has recently been changed by the CDC from 15 minutes of continuous exposure to accumulated time within 24 hours. So close contact is now defined as being within 6 feet of a person or persons for a total of more than 15 minutes in a 24-hour period. And how do you reduce that time is one is physical distancing or social distancing, two is masking, three is how hard are people breathing, and four is can you turn over the air fast enough to reduce the viral load in the air. Oops, wrong button. There we go. Hopefully this will. So the data that I'm going to go through is really cohort and case control observational data, and I would call these natural experiments. This isn't the randomized control trial that you'll read about in the scientific literature where a group of people are divided into a treatment group and a transition or a control group, and then followed, and then you can compare the results. Now, from these from randomized controlled trials, you can start to look at cause. From the observational data, we can look more at association. And so the epidemiologic data that we're going to look at is from this observational type of data. So how is COVID spread? Well, initially we were really worried about surfaces and cleaning surfaces, and now we realize that this is more an airborne disease, and that's spread by droplets and aerosols. Droplets are larger particles, usually larger than 5 micron, and aerosols are smaller. And what I think of is droplets, like the droplets you can see when somebody sneezes, or the droplets sometimes you see when somebody's shouting or yelling, and versus this very small particles that you may encounter when you are walking through the perfume section of a department store. So smaller and smaller particles as you move out to aerosol type spread. The difference is that the large droplets fall out of the air pretty quickly, and the aerosols stay in the air for a longer period of time. So with droplets, you're reasonably safe in a 6-foot diameter. With aerosols, that safety zone is larger and not quite as consistent. So one of the interventions is masking. And this cartoon shows an infected person talking to a masked person and an unmasked person. So the unmasked person with an unmasked symptomatic person in their company is at maximum exposure. If you mask the infected person and mask the other person, you're at minimum exposure for droplet type and aerosol type infections. So masking is one of the primary interventions that we have, and probably is underutilized in our country. So somewhere between being alone outside, running or skating or biking, and crowded together in some indoor activity, there's a tipping point between what's safe and what isn't in the spread of coronavirus 19. And the variables that I just ran through make a difference in how safe these crowds are. So what we want to do now is look at some of the data that supports trying to minimize your exposure. So the first slide that I have up here is from a church choir practice in Washington that occurred early in the pandemic. A group of about 60 choir members got together and practiced in the basement of a church. It was a small space. They were socially or physically distanced, but but the air turnover wasn't very high. And 87% of that group contracted COVID-19. So you want to avoid masks, avoid groups. You want to wear masks, and you want to stay 6 feet apart as much as possible when you're in a group. The second slide, which I think really supports masking, is the hairstylist group. 2 hairstylists who were both infected with COVID-19 saw 139 clients, each for more than 15 minutes, and both were masked. The stylists were masked and the clients were masked, and there was no spread of disease. So masking can be effective in these interactions that we have, and it does reduce your risk of getting the disease. And here's an overnight camp that was in Wisconsin. At the start, when people arrived, there was a young camper who tested negative in the week before, but converted while he was there. And from that group of 152 students and staff, 116 contracted the disease. So when you're in an area where people are congregating and they're not masked and they're not socially distanced on a regular basis, your risks start to go up. So, oops, a little too heavy-handed with my my advance here. So here's a family gathering. So this would be your typical summer gathering on the beach with the family, getting together for an extended stay. And one of the 20 relatives that stayed in this house was infected at the start. And by the time they left, 14 who had shared the house had become infected. The people in the house didn't stay 6 feet apart and didn't wear masks. There were 6 additional relatives who came to visit, but they stayed outside and they wore masks and they remained physically distanced, and none of those folks got infected. Now, the next slide here it moves us to an indoor sporting facility. So this is a hockey game amongst a group of recreational players. So 22 guys got together to play a game, and 6 were on the ice on each side, 1 in each goal, and 5 on the ice and 5 on the bench on each side. And 14 of the 22 players developed COVID after their indoor game. Now, they weren't masked, but they were breathing hard, and they were indoors in a more confined space. Now, this graph is what's called a forest plot. It's looking at what's called an odds ratio. So what are the odds that you'll get the disease if you're in these situations? And if the dots land to the right of 1, that's good, and if they land, or that's bad, and if they land to the left of 1, which is less than 1, that's good. And you see with the arrows I've marked the situations that have the highest transmission, which is restaurants, gyms, bars, and churches. And interestingly, the data from Minnesota was just published this morning from the last few weeks, and most of the cases that are active right now in Minnesota where COVID is surging come out of restaurants, gyms, bars, and churches, particularly weddings. Funerals also, but weddings are a big one. So those are 4 situations you probably want to try to avoid. I was surprised that home gatherings of more than 10 people weren't more involved, although it's some of the data that's coming out now seems to imply that gatherings in homes, especially where people aren't staying socially distanced and aren't masked, are becoming a greater risk. Now here's 2 soccer teams at the same university, the men's and women's team. They reported for training on day 0, and somebody had a birthday on day 9. Everybody went. By day 12, some of the attendees were starting to test positive. And on day 17, they had a co-ed soccer game. On day 18, they put both teams in quarantine because the number of positive tests was rising. And this outbreak in these two soccer games resulted in a 22-day shutdown for the teams, which, for a 10 or 12-week season is a big portion of the competitive season for these kids. Let's see, I skipped a slide here. And Allie, could you go back one? There we go. Back one more. Now forward one. Okay, now I'm on track. So there have been several large gatherings in the country over the past couple of months, and the one I picked to look at is the Sturgis Motorcycle Rally, mainly because my wife and I were on a road trip and we were planning to stop in the Black Hills and until we found out the Sturgis was going on, and they had 370,000 attendees. And there was a large spike in the counties that had the highest number of attendees, increasing the percentage of cases by about 13% in the high attendee counties. There were really no rules or regulations at this gathering, and the only requirement was that a person in attendance at the rally had to have a mask in their possession. They didn't necessarily have to have it on. And if you look at the cases that came out of here and assume that all were non-fatal, the public health cost of this is estimated at $12 billion. So there's a health cost to people getting together. The other large gatherings have been the Trump rallies, and this is a mathematical modeling done by the group at Stanford. It tried to simulate what's happened with folks who attended these rallies, and the estimate is that the confirmed cases are increased by over 250 per thousand for 100,000 residents in the area. And if you extrapolate that, the modeling shows there's probably 30,000 more cases than would have been had the rallies not occurred, and it was probably responsible for about 700 deaths. Not all primarily, that is, some of the deaths occurred amongst people who were infected by people who attended. So there's an adverse outcome to these large rallies. The other piece of data is the number of deaths, and one way of counting deaths is just counting up the death certificates. The other is to look at how is the number of deaths changed over the time period, the same time period from the previous years. And this is comparing the past 5 years to this past January through October. And the number of excess deaths beyond what had been in that series of months in the past was almost the same as the number of deaths by counting the death certificates. So we're pretty sure that there is excess deaths from this. So again, to go back to how the virus is spread, it's exposure time, and that affects your clients and your personnel. Masking, are people wearing masks to try to keep the exposure down? Are people staying physically distanced? And are people breathing heavily, singing, cheering, exertion? And is there ventilation that's adequate to disperse the air and remove the virus from the air? So to look at what's been going on in Minnesota, we've had fall sports. The fall sports in Minnesota are traditionally outdoors: cross-country, soccer, football, and tennis. We did add volleyball and swimming, which are more indoor-oriented sports. Of the 57,000 athletes that we have participating this fall over the seasons, we had 390 positive cases. So the rate is 680 cases per 100,000 athlete seasons, which if you compare it to our current case rate of 67 per 100,000 population in Minnesota, is probably about the same, or at least probably not much higher than the background infection rates. So how do you keep indoor facilities the safest they can be? I use the 4Ds: double the distance and don't draft. And the don't draft is more for running and biking, but try to stay as far away as you can from people. Now, that's not so easy when you're playing basketball or involved in exercise groups that are close together. You want to wipe down the equipment and use the hand sanitizer, although the air is probably more important than the contact. You want to look for places that have high volume air turnover, so high efficiency air conditioning and fans, and preferably windows open and outdoor air. Now, in Minnesota, outdoor air is right around 30 degrees right now, so it's not going to be very warm. So we have to figure a way to get around the heating part of indoors. You may have to limit the number of people in the facility. I think it's important to stay masked as much as possible, especially for the folks who are there all day, your workers and people who are supervising the area. Maybe we should be looking at entry screening. I know when I went to see the doctor last week, I got screened with questions and a temperature. That might be an important part of trying to reduce the rates. And then we need to potentially keep entry logs for contact tracing as people come and go from our facilities. So how do you protect yourself? I think it's be outdoors and in spaces with good ventilation as much as possible. Avoid crowded indoor spaces and ensure that the indoor spaces are ventilated as best you can. Stay at least 6 feet away from others and cover both the mouth and the nose with a mask. Wash often and use hand sanitizer. If you're sick, stay home and isolate yourself from others. And then routinely clean and disinfect the surfaces to try to reduce the spread by surface contact. And I think the thing to remember is safety first. These are our kids out there and our employees, and it's important that we try to keep them as safe as possible. I think personally that exercise is critical. I think it helps improve the immune system, and as was pointed out in the last presentation, it has so many positive effects for learning and general health that it's a critical part of trying to stay healthy in the time of this pandemic. But how to do it in a safe way with kids who are competitive is a difficult task, especially with winter coming on and a lot of our activities moving indoors. So I thank you for your attention, and we'll have questions as we move past the next presentation here. Thank you.
Thank you so much, Dr. Roberts. All right, bear with me while I pull up Jason Clements.
And while that's being pulled up, I will make the note that I'm the only panelist that's not a doctor here. So I appreciate you inviting me. But kind of to preface, as the PowerPoint's coming up here, what I'm going to share is just real data and information based on the facilities and complexes that we manage across the country. I'm going to share some of the response guidelines as our venues reopened that we're utilizing, and I'm going to share some of the lessons learned. I mean, we had some venues opening up as early as April in some of the earliest states that were reopening in Missouri and Alabama, and so we've learned a lot since April and May in terms of what works and what doesn't. Both Dr. DeFina and Dr. Roberts articulated very well how much we've learned about the virus since that time even, and that has certainly influenced some of our policies, procedures, and guidelines that have allowed us to generate, I think, some of the results that are good results in our indoor and outdoor complexes that we manage.
Thank you.
Did I give you enough time?
So yeah, Well, you may not be a doctor. You're going to have a unique perspective that I know much of our audience is eager to hear. So again, this is Jason Clement. He's founder and CEO of Sports Facilities Companies. I also just wanted to remind everyone to submit your questions, as after Jason's presentation, we will be addressing all questions that have been submitted. All right. There we go.
Okay, here we go. So as I shared, this is what we're going to cover, kind of our COVID response, some stats and data around what we found, and then ultimately lessons learned. What are we going to keep doing? What have we stopped doing because it wasn't effective or a good use of resources? And what have we learned to start doing, over the last 6 months as we've opened up some of our complexes. So a little bit about us to start. Here we go. At the end of 2019, we were managing venues in 16 states. And for those counting, that's 16 different governors, closing down their state and then reopening their state at different times. At the end of 2019, we had 25 million guests in our venues, kind of across that footprint that we had. And we've evaluated $10 billion in planned projects. And I guess kind of anecdotally, we found that, as you would imagine, from March to June, there was a real slowdown in people looking to build new sports complexes, primarily tailored toward youth activities. But really since July on, we've been inundated from communities that are looking to build new complexes. So our mission, as you can see it to the right here, but it's important, it's to improve the health and economic vitality of the communities we serve. Historically, we've been doing that through healthy programming and activities. I appreciate, again, both Dr. DeFina and Dr. Roberts talking about the impact that healthy activity, exercise, fitness, and sport provides for families. Most of our complexes are directed toward youth programming, but we do also manage, traditional, what I would call traditional community recreation center, park and rec centers, and there are a number of adults that participate in that programming, and certainly the membership-based fitness centers. So we felt pretty good going into 2020. We thought we looked, really good as an organization. And by the middle of 2020, we were looking a little bit different, as you would imagine here. One of my favorite is this one for you superhero folks. Going into 2020, we felt we were looking good, and by the middle, this is what we look like. And my final one here is, if 2020 was a drink, what would it be? It would be colonoscopy prep. So it's been kind of that year, for a lot of us on the call here. And hopefully what I'm going to bring is some pretty good news. So when the economies and when the facilities started to shut down in March and early April, we kind of went into overdrive from our perspective. We've got a number of complexes across the country, really good, smart operators. We convened, almost immediately our COVID response and COVID comeback committee. And that committee's job was to come up with the guidelines, policies, and procedures that we needed to reopen as safely and healthy as possible. And if we can cover the safe and health part, as quickly as possible, because we recognize the impact and difference these facilities and venues have in our communities. So really every guideline, that we went through, starting with the facility owners and, who we were, kind of beholden to, what do they need in terms of coverage. Every one of the guidelines that we reviewed and created was based on 4 different criteria. The first is how can this provide the most safe and healthy environment as possible. The second piece to it was, what does this mean operationally, both in cost and also personnel and human personnel. The third piece to this is what liability is created as a result of this guideline or not instituting this guideline. And then the fourth piece is what's the visitor or consumer perception of this particular guideline. So obviously safe and healthy is first, but we want to make sure people feel safe and healthy as well when they're coming in. So you can see here as these kind of roll on some of the areas that we looked at. And I would just share, and we've been doing this since we put our first draft together in April when we reopened our very first venues. we've been sharing this with anybody who has interest. So you can go to our website, which hopefully you can see here in blue, and or just email us, and we're happy to send our copy of our COVID guidelines and response that we've been using to reopen. The second piece to this is, as I mentioned, this is an evolving document for us. So it's almost like the first draft was the Constitution, and we've had, amendments and the Bill of Rights and whatnot that have come on since then. And so we've put together a second committee now that it began early on, every week, kind of reviewing lessons learned. And so as new venues opened, or as we built relationships with folks and venues that we don't manage, we started getting ideas and thoughts and concepts. We would throw them into this committee, and every week they would evaluate them and then update, some of these guidelines and procedures. So again, feel free to, rip this off if you'd like, but this was our plan going into reopening. And, the great philosopher Mike Tyson once said, everyone has a plan until they get punched in the mouth. So we were prepared to get punched in the mouth a little bit when we reopened. And the good news was that we've really had a lot of success along the way. So as I mentioned, we've had 16 states. Of those 16, 12 have reopened fully. We have multiple venues in some of those states as well, but 12 have reopened fully. 3 have reopened partially. And as of this week, one state, North Carolina, was still, shut down. So, but that's, I think, next week going to change. As a result of that, we had 300 plus events and a lot more local programs that were displaced. They represented $100 million in visitor spending. We were able to reschedule 50% of them. So when I say displaced, the other 50%, we didn't cancel. We were able to move into the fall, winter, and certainly into 2021 as well, which has been good. Since reopening in late April, we've had 300 plus events, and they've produced $60 million in economic impact. Again, we don't suggest that we are making decisions just based on the financial outcome here. But the reality of this is that it does have a financial ramification in a lot of industries here. And we're, proud that when we've been able to reopen safely, we've been able to be, the tip of the spear in these communities in terms of bringing visitors back in a healthy and safe way. We're primarily talking about youth programs here. I think adult programs would have a different transmission rate. But as you can see on the screen here, the stats are out of 1 million plus visits into our venues across those, 15 states that have reopened in some capacity. We've had a grand total of 22 positive cases that we're aware of. And of those 22 positive cases, out of all of those events, 13 have been our staff members. And we're screening, every staff member at the door when they come in. We're doing the temperature check and all of those sorts of things. So as soon as we screen, and if there's a staff member that exhibits symptoms, obviously we send them home and take care of quarantining and all of those things. And then the remainder of our staff get tested, and we want to make sure that there's no transmission from that perspective. Of the 22 positive cases, the remaining 9, 4 were a parent, coach, or official, and 5 were participants, youth participants, as I mentioned. And based on our tracing and the best we can do in following up with the folks, we've had 0 transmissions inside of our venues. So that's a really good outcome, obviously. And really what we have subscribed to here is it doesn't have to be an either or. It does not have to be, healthy, choosing health or economic vitality. It can be both. And we haven't fallen into the trap of thinking it's one or the other. And that's an important component here as we look at it. So as we review some of our keep, stop, and start, and I know I'm short on time, so I'm going to roll through this pretty quickly. The things that we have found that have been really helpful and have worked well is the screening, verbal questions, as well as temperature checks for our staff. I'm going to jump to the stops and kind of bounce around here. What hasn't worked on the stop part of it is mandatory temperature checks for all participants and all visitors coming into our venues. That has not been successful. There are a lot of asymptomatic, clearly. Just because, we're reporting 22 cases, it doesn't mean we haven't had other asymptomatic carriers that have been in and around. But again, we haven't received any feedback, 0, of, us being a hotspot, knock on wood, where cases have transmitted and things have been traced back to things scaling out as a result of any event or any of the venues that we manage. We also found what's really helpful setting expectations, though, when people come in the door. A lot of signage, going over the things that Dr. Roberts mentioned earlier in terms of good practices and what we expect. Almost all of our venues require a mask when people come indoors because of local ordinances that have been provided there. Almost all of them now don't require participants who are playing in sports to mask up at all. And we're doing basketball and volleyball and a number of the indoor sports that you would think along those lines. But again, I can't reiterate enough the importance of signage and really, pardon the cliche, but killing our visitors with kindness. When they come in, we share, hey, it's a privilege. We're grateful they're here. It's a privilege for all of us to be able to come together. We all recognize the importance of sport, and we would expect everybody to respond responsibly. And so far, the vast majority of people are doing just that. They've responded responsibly. We have a few people who, be difficult because they choose to be, but the vast majority of us, and I would say based on the data and the million visits that we've seen, want to do the right thing, want to be respectful of one another, and want to come together for the good of allowing one another to participate in sport. I heard earlier today that rarely do you hear something that has bipartisan support, and playing sports in a healthy and responsible way is something that in an election season in a highly charged political environment has been overly positive on both sides. These guidelines that we have provided, they've been sent to governor's offices in a number of states to demonstrate reopening, and the data and stats that I just shared have been, what I've been told, instrumental in helping get governor's offices comfortable with, again, opening responsibly. So I'm going to, I think, cut it here. But just to share, you can come to our website. It's sportadvisory.com. You can find our COVID reopening guidelines. Again, we're giving away whatever we can because the reality of this is we all understand the importance of sport, healthiness, healthy activity, and exercise. And if just one of us doesn't do this responsibly, it could be a black eye for the entire industry here. And if you see something that you think is a good idea, send it to us as well. We've been ripping people off, in terms of their ideas along the way. There's no pride in authorship or ownership here. We don't need to be right. We just want to get it right for the industry because we all believe that reopening in a healthy, safe way is good for our communities. So with that, I think I'll turn it over and we can get to the Q&A piece.
All right, thank you so much, Jason. Yes, we did have several questions come in. So our first question, this is actually a question for you, Dr. Defina. You talked about how kids' activity has dropped so much. As weather gets cold and everyone moves inside, even more decreasing physical activity is likely. Parents want their kids to be active, but are nervous about exposure. What advice do you have for parents who want their kids in sport and PE, but don't want to do the wrong thing?
It's a great question and a great fear a lot of parents and schools have. And I would really refer to what Dr. Roberts outlined and Dr. Clement today. But, it's very important to follow the social distancing guidelines and to mask when necessary. And at this point in the schools that we're working with, a lot of them are choosing not to be playing sports right now, but to be doing physical fitness things such as push-ups, jumping jacks. And so the opportunity to still be active, learn potentially life activities versus sports you might play as a child is beneficial to all kids. So we are certainly educating. We are certainly recommending not that they stop, but they do things safely, and that they, again, an inactive kid is a kid who's at risk for diabetes, obesity, and all those other things. So we really believe it's critical, with the caveat that each school, and what's a little unique about schools are, when you talk about, you're working with 16 governors, well, when you're dealing with schools, you have a head thousands of heads with thousands of different ideas. And so I just encourage parents to look at the resources that are put in play at the school. And if their school doesn't offer physical activity, determine what's available in the community.
Thank you so much. This is a question for all of you. So if we can take turns for each of you. It's been repeated that masks are important. What are the recommendations for kids playing basketball, hockey, and volleyball with a mask on?
Well, I'll take a stab at that. I don't know that there's any real solid recommendations on what you should do with masking and while you're playing sports. I do a lot of outdoor sport in the winter, and it's cold. You know, this is where I live is Minnesota. It can be minus 40 degrees. And so I've worn masks while I'm exercising, but I don't really like it that much. I played hockey growing up. I don't know that I would have liked to have played with a mask on, but given the choice between playing and not playing, I'd play with a mask on. I think that we'll be seeing as people move indoors more face-to-face contact in sports, and so volleyball and basketball and hockey and wrestling, in particular wrestling, are very face-to-face. And I'm not sure I see masking as an easy way out, but something that I certainly would consider if I was doing the sport, unless of course I was an adolescent, which I would think I was immune to everything and probably not do anything anybody suggested. But I see it as kind of a difficult thing to enforce and to do. So I think that moving outdoors and as far from other people for all your as many activities as possible is one part, and the other is to moving into facilities that have proven track records that are that have ventilation, that have systems set up to try to reduce your risk while you're there. And I think today Dr. Clement has outlined some of those kinds of facilities, and I think I have never witnessed a change in medical science and thinking that's anywhere near rivaled what we're going through right now. And trying to keep up with the data is really hard. So you're going to be looking to people like Dr. Defina and Mr. Clement to get recommendations and try to do the best you can for yourself and your kids, and try not to get infected.
Yeah, I would just add in that we've had mandatory masks in a couple of our venues early on for hockey and basketball and some of those things, and since then that's been rescinded. And those are local and state mandated things. And I'm not the doctor here at all. I'm just using the data that we've seen here, and so far, and we're not into the winter season yet. But it has not, we haven't seen a massive spike in transmissions, in and around. And again, these are youth, and I think the doctors can probably speak to whether the youth have a higher transmission versus adults and the things that we're learning there. But, I would just suggest let's err on being responsible here, in terms of what we should do, and let's be respectful and go from there. And so far, 22 cases out of 1 million visits for us has been a pretty good, we're feeling pretty good about some of the guidelines that we've put in place and the way that we're managing, the complex. And when I say signage up front, around reminding of all these things, social distancing, we're putting X's where people can sit in and around, these courts, and playing spaces. All of that again is in some of the documentation that you can download. You can see examples of signage and other sorts of things as part of that as well.
Yeah, U.S. Soccer just released their guidelines and advice yesterday. to the general public, and you may find some other ideas there. I think they reflect very much what Mr. Clement's doing in terms of, larger spaces, spacing people out, using masks when it's possible, and trying to just make it as safe as you can. And I just think of the simple saying, safety first. And if you don't feel comfortable, you probably shouldn't hang around.
All right, we're going to try and squeeze in 2 more questions, as I know we only have 5 minutes left and we've received many more questions than we'll have time for. So the next question, Jason, this is to you, but also I'd like to open it up to everyone. Jason, with only 22 positive cases and only 5 being youth participants, what do you attribute that success within the venue to? And my question to everyone would be, what do you think people are missing or getting wrong as they try to reopen that you guys have done so well?
Despite the, narrative that's out there, I think people generally try to do the right thing. And, when we put the proper guidelines out there, my kids are playing youth sports right now as well. Our teams are constantly talking about right now, hey, if anybody has any symptoms at all, it's not a scarlet letter. This is something that's rolling through our population. Just raise your hand, and tell us. And we've had, one of my son's teams had to shut down for 14 days. And we're finding teams are doing that. In places where we're running events, we're having teams, cancel and back out because they've had a positive case and some of those sorts of things. And so we'll we thank people for doing that and being responsible and respectful of everybody else. So I attribute it to generally people looking out for the common good here and not taking for granted the fact that this is impacting people, and there are people that are dying from it, and we're taking that seriously. And at the same time, it doesn't mean we have to, shut everything down. So now I'm sharing my opinion a little bit here, but if I felt differently, we would be opening our complexes. And we can do both. We really can do both. And that's what I'm hearing the panelists here. And we're probably on different, various ends of the spectrum here, but I think we all share that. And let's be safe, let's be healthy, let's find a way for kids and families to be active. And we can do all of it at once here. So I attribute it to that. People show up, they're respectful, they look at the guidelines, they're grateful to be there. And along the way, they're, testing themselves and monitoring themselves so that they don't put other people at risk when they come into the venue. And that's very much the attitude we take when people show up. Let's not put others at risk here. You have a responsibility far beyond yourself and just your family and just your team. And boy, I mean, 99% of the people have responded to that message positively.
Yeah, I would also add a quote from the early 2000s that we found quite effective. If you see something, say something, and help those around you do the right thing. So we're heard to say that.
All right, so next question, is there any empirical evidence that shows or suggests that COVID transmission is higher in some sports rather than others?
I personally have not seen anything yet.
You have yours broken down by sport, but we don't really have, and when I look through the high school league data from Minnesota, we don't really have much difference between sports because the numbers are so small. So we have a pretty good denominator, and we actually know how many kids are participating. We have a fair total number, but it's hard to know for sure that everybody's reporting accurately. So there are some limits to the data that we have, and I haven't broken it down by sport, but we do have that capability. What we're looking for is what are there changes that are occurring as we're moving indoors. So as we added volleyball a few weeks ago, we were looking to see if there was a spike. And as we added football, which is more face-to-face than some of the other sports, we're looking for a spike. And as we start to add in hockey and basketball and wrestling over the next few weeks, we'll be monitoring for spikes. And I think it's the data is still really evolving and it's still really young. I mean, we're 6 months into a pandemic that none of us have ever seen or before and don't really know exactly how to respond. So that would be my quick answer.
All right, we're going to squeeze in one last question. Jason, this one is for you, just because it's so important. I think a lot of people are going to be interested to know. Does it require a lot of extra resources, money for signage, et cetera, staff time to institute these safety protocols? Do you think local schools and park programs can do the things that you all are doing?
I'll answer the second question first. Yes, I think they can. And I think as you get into the guidelines here, you'll see that the vast majority of them are common sense things and aren't that heavy of a lift or that big of an investment. So that's the first part of that. The second portion of that answer is we are doing some things in terms of staffing up, right, so that we've got more eyes on the courts and in and around the venues. We have enhanced our sanitation, policies and procedures. We used to clean our venues overnight on some of the big events. We stopped doing that, and we are, shutting things. It's almost like a pool, it's a summer pool where you shut everything down to put the chlorine in. Back in the day when you were young, and some of those pools do that still now. We shut down the events and we do kind of a mass clean periodically throughout the day. It does two things. One, it's constantly sanitizing the venue, despite it being airborne versus the surfaces. The other thing it does is it just brings some confidence to those that are coming in, and they're seeing that. And we actually in a number of our venues have bright yellow shirts for our clean crew. We call it the clean crew. So there's just a number of things you can do to engender confidence while you're also promoting a healthier, safer, and more highly sanitized environment.
All right, thank you so much. I know we're just a couple minutes over time, but thank you all so much for joining us today. I just wanted to remind everyone that on Thursday, we will be hosting another webinar, which is going to be our second webinar in this series. Just to give you a little bit more context on it, this webinar is, it's taking a little bit. This webinar is going to have Omar Mitchell from the NHL, Dr. Carissa Niehoff, the Executive Director from the NFHS, and Jamie Davis from USA Volleyball. This conversation is going to provide perspectives from leaders and rule makers of the most popular indoor youth sports, basketball, volleyball, and hockey. As we prepare for our first indoor winter season and athletes are returning to competition, it is so important that we do so safely. Make sure your organization is using best practices to prevent the spread of COVID-19 and join us at 2 p.m. Eastern on Thursday. It's free to everyone. Register at the link shown here. On another important note, we all know that cost was a barrier to participation pre-COVID. Now, in a post-COVID world, there's going to be an even greater emphasis on physical health and safety on people participating in sports, which will require additional investments and health and safety measures to protect people playing indoor sports. The leagues and facilities are going to have to come up with the additional safeguards to protect players, meaning the leagues will be responsible for providing PPE to limit the spread of COVID, among investing in many other costly precautionary practices. To make physical activity expenses more affordable, to help young athletes get back as soon as possible, help us make physical activity more affordable. Join us in our efforts to pass the FIT Act, allowing for all physical activity related expenses to be tax deductible and help lower these increased costs. This allows parents, leagues, and facilities to return to play in a safe environment. And we have made it so easy for you. We have created a site which will allow you to send a pre-composed message directly to your representative to voice your support of the FIT Act and encourage them to do the same. Go to the link shown here and send your message today. We appreciate you taking the time to join us and hope to see you all again on Thursday at 2 p.m. Eastern for our second discussion on the youth team sports moving indoors. Thank you.
Thanks for having me.
Thank you.
Thank you. Have a good one.
You too. Bye-bye.